going to check your irises and your pupils, making sure that they're not discolored and that they're equal. I'm going to have you look forward. I'm going to check your pupils with my pen light. And they should dilate with the pen light. The other side. Now I'm going to check for accommodation with your eyes. I'm going to have you look at my finger and then look in the distance. And then back at my finger, back and forth. When she looks into the distance, her pupils should dilate. And then when she looks at my finger, they should constrict. Good job. Now I'm going to check for your 6 cardinal fields of gaze. So I'm going to have you look at my finger and follow my finger. Now I would check for her red reflex with an ophthalmoscope. However, I don't have an ophthalmoscope, so I'm going to use my pen light. Check for them. Good job. Now I'm going to check your ears, making sure that they're not inflamed, there's no discharge, they're equal in size. There's no pain when I do this. Pull up on your pinna. Now I would use an otoscope to check the inside of her ear. I would pull up and back and then place the otoscope inside of her ear about halfway and look inside. Inside I would see her tympanic membrane, and I normally would see a little bit of cerumen too, which is earwax. Now I'm going to check your hearing, so I'm going to do a hearing test. Place my finger over your ear and whisper a word and have you repeat it back to me. Apple. I'm going to check the other side. Baseball. Right. Now I'm going to do 2 other hearing tests with my tuning fork, which is a real fork because I don't have a tuning fork. So I would strike the tuning fork. This is the Weber test. I'm going to strike my tuning fork and place it in the middle of her forehead and see which side she can hear the sound most on. This is a test for lateralization, and if she can hear it on one side more than the other side, that might be a sign of hearing loss. Now I'm going to do the Rhine test. And I would strike the tuning fork again and put it on the mastoid bone. And wait till she can't hear it anymore. And then strike the tuning fork again, put it close to her ear until she can't hear it again anymore. And I would ask her to tell me which she could hear more, towards her ear or on the bone. And normally she should say that she could hear it towards her ear better than on her bone, because air conduction is better than bone conduction. Thank you for being my patient.
You're welcome.